Welcome back to Morning Coffee. I'm Jim Cuccinata. Must be Tuesday, and it must be our health segment. I'm here today with Ed Frost. Ed is the owner of CPAP America. CPAP America is a kind of cool company that Ed's going to talk to you about. Enables you to save money while having a choice on sleeping better. So I want to welcome Ed.
Thanks, Jim.
We were talking a little bit earlier, and we said that CPAP America is kind of a one-store idea now, but it's going to take over the world. So why don't you tell everybody about it?
Yeah, CPAPamerica.com is a unique hybrid medical supply company. We strictly focus on sleep apnea, the equipment, the supplies, the treatment, the clinical prowess that's needed to get you to actually use the equipment and to benefit from it. It was born from essentially the ever-changing healthcare system where a lot of folks are now insured, and a lot of people feel good about that, and it's a great thing. Unfortunately, a lot of people are suffering from extremely high deductibles in order to be able to have that essentially catastrophic coverage. So a lot of the lower level tiered services, durable medical equipment, are really subject to these high deductibles now. And if your doctor says to you, Jim, you need to get a sleep study, oftentimes that's not going to be covered out of your insurance. You're going to have to meet your deductible first.
Right, so it's coming out of your pocket, and obviously it's a burden.
Oh, exactly.
Most people that are getting asked to have sleep studies tend to have other issues.
Oh, exactly right. I mean, there's a ton of other health risks associated with sleep apnea, primarily being high blood pressure, diabetes, excessive daytime sleepiness, headaches, a lot of associations with migraines, and even fibromyalgia is even linked back to sleep apnea. So, it's a health epidemic essentially that is showing that over 40 million Americans actually have this condition, but less than 20% of them are actually getting treated and are being compliant for it.
Okay. I'm here with Ed Frost, who is the president of CPAPamerica.com. We're talking about sleep. We're talking about sleep apnea. How did you get involved with CPAP America?
Well, I'm a respiratory therapist by trade. I've been a therapist for 25 years now, actually. I actually sit on the State Board of Respiratory Care. I've been an active member of that for just about 2 years now. In my career, I've been very fortunate to do many different things in respiratory care, and right around 2001, I really got involved in sleep medicine and began learning sleep medicine because it's very closely related to respiratory care, and had the fortunate to build within the company, and I ran over 27 sleep labs across the country.
Oh, wow. And you became a sleep expert through obviously practical experience. And what kind of credentialing did you have to get?
So as a registered respiratory therapist, sleep falls under our scope of practice.
Okay.
There are other specialties, registered sleep polysonographers, which is a specific course track that you can take to be just a sleep technician. Respiratory therapists cover all of that in our education and training.
Great.
So it's been kind of a cumulative thing between classwork, seminars, and obviously hands-on experience throughout several years.
Excellent. So tell me, if I'm a patient and the doctor gives me a script and it says I need a sleep study, what's the process to start working with CPAPamerica.com?
Well, I can tell you, what the biggest thing that happens to folks is that they have this script, and the doctor's office may send them right to a hospital or send them right to another sleep lab. And the mistake that consumers make is that they don't pump the brakes, call their insurance company and find out, hey, I have this prescription, what's it going to cost me out of my pocket? So whether you come to us for service or not, please, as a consumer, take 5 or 10 minutes and get to know what your benefits are.
Right.
And not just for me, but for x-rays and everything, lab work, everything.
Sure.
Because we are creatures of habit, and we do what our doctors tell us to do.
Right.
But we never pump the brakes and check and see what's it going to cost us out of our pocket.
Sure.
So get that number, find out what it is. I mean, if you're going to be covered, great. Go get it done as soon as you can. And then after your study's done, find out how much it's going to cost you for the equipment.
Right.
And that's where we come in. I mean, the average CPAP equipment coming out of a doctor's office with a prescription from a home care company, could cost you, even if you're covered, about $100 a month for 4 to 5 months, and then additional costs out of pocket over the course of a year.
Okay.
Because you could actually look at, even with insurance company, unless you have a platinum plan, spending about $1,000 a year for your equipment and supplies.
For equipment and supplies. Okay.
So we're a fraction of that cost.
Right.
And we also even offer in-house financing for folks that just can't, afford to pay for it all up front, which is unique.
And what I thought was really interesting about your model is you also have a storefront.
Exactly.
And people can actually walk in and kind of walk out with their sleep study stuff, correct? Or
Yeah.
come back and get their daily supplies.
Yeah, exactly right. I mean, it's a unique model. I mean, typically you would go to a home care company where they would come to your house. The therapist would bring a couple of different masks, and pretty much your choices are limited to what he has in the bag.
Right.
In our shop, you can come in. We have all the masks available. You can try them on. We set you up with a nice, comfortable pressure so you can actually see what it's like.
Mm-hmm.
And then you walk out of the store with something that we know that, with all good certainty, you're actually going to use.
Right. Good. And is the plan to have 100 stores around the country, 1,000 stores around the country, or you want to be more of a .com model?
Well, we looked at both models. The .com model is a great model. It's a little complicated. It's difficult to compete in that space.
Right.
We think our best successes have been boots on the ground, local community,
Right.
letting people know that there's a shop for us. And I think, organically, that's probably the right way to go for us.
Right.
And I like that much better, being in touch with my community, having people come in.
Sure.
I live in West Effort. I see a lot of my clients at local events, and everybody looks more awake and happy and
Sure.
and comfortable that they actually have somebody local that they could come in and sit and talk with. And
Well, absolutely. I mean, right? People like to buy from people, and they really like to buy from people they're going to see.
oh, exactly right. I mean, our biggest issue is a lot of folks are, and I did it this morning. I bought from Amazon. You probably did
Right.
it last week.
Yeah, absolutely.
Which is great. I mean, we have to save money. We have to be smart, and if you know what you need, that's fine.
Right.
But a lot of people get stuck in ordering these supplies and this equipment from Amazon. First of all, they're not supposed to be selling it, but they still get away with it.
Right.
And in order to be an authorized dealer, you have to have a clinician behind you.
Okay.
So we're a licensed medical facility.
Mm-hmm.
We're bound by rules governed by My Practice Act and the state of New Jersey and national law. So you may find it a little bit cheaper on Amazon, but
Right.
you're not going to get the 24/7 compliance and the 24/7 support that you would get from purchasing something from Amazon.
Absolutely, and you get the personalized service, and you had mentioned earlier about the mask fittings, and you get somebody to come in, they can actually bring their equipment in. You guys can take a quick look at it and see if it's functioning properly. So you give a lot of peace of mind, I would imagine, to the local community.
Absolutely. I mean, one of our big niches is that we really like to work with our commercial drivers.
Mm-hmm.
A lot of big government regulations are coming down upon commercial truck drivers that if you look a certain way, act a certain way, you have a certain body size, DOT medical examiners are telling you have to get a sleep test.
Okay.
Yeah, and a lot of these guys are 1099 employees. They're self-employed. They don't, they have health insurance or they may not have health insurance. And, they're being pushed in directions where it's going to cost them thousands of dollars to get tested
Right.
and to follow up.
Sure.
So
it's funny, right? So people with the CDL, the commercial driver's license, they tend to live a very unhealthy lifestyle, right? They sit all day. They eat literally while they're driving, right? They tend to be overweight. They tend to overuse alcohol. They tend to use some kind of sleep aid to go to sleep, right? So they have this very unhealthy lifestyle. But recognizing that you have sleep apnea probably is huge for someone like that.
It's huge, and it's unfortunately it's the culture we've created. It's a very transient lifestyle. They have to drive so many hours a day. They keep decreasing their mileage rates, increasing the gas costs. I mean, these guys are really pinned down by regulation, and a lot of them feel like it's a great thing that somebody's actually helping me.
Right.
But there's the vast majority of them seeing it as it's it's a scam.
Yeah.
You're hurting me. You're trying to keep me from working. And to those guys I say, take a couple of minutes, just do a little research on what sleep apnea is.
Right.
And you'll quickly see that if you stop breathing, we define one event as stopping your breathing for up to 11 seconds and dropping your oxygen level. One event. Well, in order to be diagnosed with sleep apnea, you have to have at least 5 events of those an hour.
Okay.
And a lot of these guys, the average, depending on what's going on with you medically, people with sleep apnea could actually have 30, 40, 50, 60. We've seen as high as 160 events an hour.
Wow.
And these are people that have significant symptoms of sleepiness they snore, they're gasping in their air, they're stopping their breathing, their bed partner's constantly elbowing. Things like that aren't normal, you know. And when you block off your airway and your oxygen levels drop, your body acts like it's on a treadmill. You know, your heart rate increases. You try to breathe, but you can't because your airway is obstructed.
Right.
You know, and because of that, your heart muscle is not intended to grow, but it does. You know, the muscle breaks down just as if it was at a gym. So, you know, that's my big thing with the CDL guys is to say, look, you know, this is a significant issue, and if you don't have it, fine. You know, we do an in-house. We do a home sleep test that's completely certified by the DOT for $249.
Right. It's so worth it. I mean, if you think about it, if you're a CDL, you know, driver in that profession, why would you lose your license? Why would you risk an accident? Why would you risk your health for $250?
Well, exactly right. I mean, and why would you put someone else's life at risk? You know, constantly. I mean, we're up and down the turnpike every day.
Right.
You know, I don't want to get next to a driver who's non-compliant with their sleep apnea.
Right.
You know, that they're not using their equipment. I don't want them dozing off with their 20-ton trailer, you know, and drifting over to my lane with no place for me to go.
Right.
You know, so really, an ounce of prevention truly is worth a pound of cure in this case. I mean, it's a disease, it's a condition that can be immediately treated and corrected, you know, with an external device that either goes on your nose or over your mouth and nose.
Right.
With relief, sometimes even that first night, people feel the next day like, wow, my life is completely different. I feel like a kid again.
They feel rested.
Yeah, you know, and the owners of some of these trucking companies, they just tell their drivers, you have to take care of this. Very few actually have good health programs in place to help them, guide them through the process.
Right.
You know, but even then, they're following the directions of what they know, and then they're getting these huge bills at the end.
Right.
So
they're getting a surprise.
They're getting a surprise. I mean, we're in just about every truck stop in the country, you know, with a little placard on the wall that says, you know, let us help you.
Right.
And it's been interesting. You know, guys are calling us saying, you know, I need this equipment.
Right.
Or, you know, my DOT physical's up. I haven't been compliant. Can you help me?
Sure.
You know, how can you get me compliant? A fella just called the other day and said, listen, I'm unemployed. I'm out of work, and my unemployment's about to run out, and I'm going to be a CDL driver. Tell me what I need to know.
Right.
You know, this fella, for example, had been on CPAP for a long time, and just as happenstance, the machine breaks a week before he's getting ready to go into school.
Sure.
You know, so we're able to hook him up with a brand new machine that, you know, gives us his compliance status, so he doesn't even have to send us his cards. We could just print him off an electronic report, send it to his examiner, and he's financing it in-house, and it's $20 every 2 weeks, and he's, you know, he's able to get back to work. He's compliant, and he's got expert clinicians to help.
Right.
And that's what we need to get the word out to those guys. You know, it's totally not a scam. This is legit.
Yeah, right. This is a real thing.
Yeah.
Are you guys going to have any type of great documentary where you're going to be walking around banging on truckers' doors with machines and?
You know, we had thought about actually going into the truck stops and kind of, you know, interviewing drivers and kind of get their opinion, and it's a little tricky though. Those guys that's their time off, and they're going to sleep, and they got to get right back on the road.
Right.
You know, so you know, we're hoping in the future to come up with a plan to do something at a local, you know, truck
yeah.
stop.
I was going to say, in-services are probably not the easiest thing in the world for them.
It really isn't. I mean, you know, by the time they're calling us, you know, they're behind the eight ball.
Right.
So, you know, fortunate that we have just about everything that you would need available right there in our shop. So, you know, it gets right out to them. You know, we get right on the phone with them and make sure that everything's going well. So it's a lot different. I mean, the other problem with dealing with your insurance is you know, imagine, Jim, if you went to the doctor and he said, well, Jim, you have extremely high blood pressure. You're going to have to wait 4 to 6 weeks to get your pills.
Right.
You know, oftentimes with sleep apnea, people come out of the doctor's office with a very significant diagnosis.
Sure.
But wait 4 to 6 weeks to get their equipment.
Right. Which is crazy. With you guys, it's next step.
It's, you know, walk in same day, call me. You know, we're accessible.
Right.
You know, I've gone in on weekends, on evenings to help people to get their equipment. I mean, it's, you know, there's no excuse to wait, and you know, we have kind of broken down all the barriers.
Sure.
You know, if you choose to go through your insurance company, you have to be compliant, or they're going to take your equipment.
Right. So I'm here with Ed Frost, and he is the president of CPAP America.com. We have a little tradition on our segment, so you're going to look into camera 3, and you're going to give a quick testimonial on who you are, where they can find you, and why they should care.
Hi, my name is Ed Frost. I'm a registered respiratory therapist. I live in New Jersey. I've been a resident here my entire life. Been a respiratory therapist for 25 years. I own a company called CPAP America.com, and we are a boutique medical supply store that basically caters to folks who have sleep apnea. We do not take insurance. However, we promise to be the lowest price on any of the equipment that supplies that you need. You know, we're here to tailor to folks who have extremely high insurance deductibles or have no insurance and have to pay out of pocket. We also have loaner machines and used machines that are reconditioned that we could help people with. We're thankful to be partners with companies like the St. Christopher's Fund, which is a nonprofit organization for truck drivers, where we help truck drivers that have no insurance get the equipment that they need. We're also partnered with Philips Respironics to help get folks equipment if they have an extreme economic need. Our company is basically, it's a clinical company first, so we're here to make sure that we give everything that someone would need who has sleep apnea in a timely fashion, and to be there for them after the sale to make sure that they're getting all the equipment and supplies and they're actually using the equipment the way they're supposed to.
Excellent. How can they reach you?
You can best reach us at cpapamerica.com, or you can call our office directly at 853-0234.
Fantastic. I'm Jim Cuccinata. I'm here with Ed Frost, and we will be back to Morning Coffee after these messages.
Saving your business money is as easy as 1, 2, 3. Tanker Consulting Services, a payment solutions expert.